Good evening, everybody. Greetings and a warm welcome to our Alumni Voices webinar. It's an absolute delight to have you all join us tonight. I'm Dr. Rebecca Klisch-Holbert, a member of the Medical Alumni Board of Governors and a proud triple graduate of the School of Medicine. I'm thrilled to be part of tonight's program, sponsored by the Medical Alumni Association. Before I introduce our esteemed presenters, I'd like to share a few essential details about tonight's event. First of all, your cameras and microphones are turned off because we have the webinar format, so you're welcome to eat dinner or simply sit back, relax, and listen. You can submit questions using the Q&A button, and we'll do our best to get to as many questions as possible. Now, it gives me great pleasure to introduce Dr. Roger Kahn, Dr. Tom George, and Dan Farhat. Dr. Roger Kahn is a Wayne State University School of Medicine graduate from the class of 1974. And a member of the Medical Alumni Association Board of Governors. Dr. Kahn is an invasive cardiologist who works to expand and improve cardiac services in the Saginaw area. Dr. Kahn's work in public service began with donating time to Saginaw's free medical clinic and later spanned to him serving as a Michigan State representative and then senator for the 32nd District. His time in the Senate helped pass the Healthy Michigan bill, providing insurance for more than 600,000 people. Next, we have Dr. Tom George, who's originally from Flint, Michigan, and graduated from the University of Michigan Medical School in 1982. He's currently the CEO of the Michigan State Medical Society, or MSMS, and previously practiced anesthesiology in Kalamazoo for 38 years. MSMS is the statewide association that advocates on behalf of all Michigan's physicians. Tom also represented Kalamazoo in the Michigan legislature for 10 years, first as a state representative and then as a state senator. He retired from the Senate in 2010 due to term limits, and while serving the legislature, he chaired the Senate Health Policy Committee and authored over 40 public acts. He's a past president of the Historical Society of Michigan and currently lives in Kalamazoo with his wife, Sandy, and they have 3 children and 2 grandchildren. And then lastly is Daniel Farhat, co-owner and president of Capital Strategies Group. He's a seasoned lobbyist with more than 40 years of legislative experience in Michigan. A graduate of the Michigan State University, he began his career as a staff assistant to the state's attorney general and later went on to serve 8 years as a government affairs director for the Michigan State Medical Society. In 1992, he founded the Farhat Group, later rebranding it as Capital Strategies Group in 2010. And today, his Lansing-based firm represents a wide range of clients, including healthcare, insurance, business corporations, higher education, and statewide associations, solidifying his reputation as a leading lobbyist in Michigan's political landscape. Voted by Crain's Detroit as 50 names to know in lobbying, Mr. Farhat has vast knowledge and experience in political strategies and legislative lobbying. I know you're all incredibly busy, and we really appreciate all of our panelists taking time to participate tonight. So I'll kick things off by maybe having you each tell us a little bit about what initially drew you to engage in the intersection of healthcare and government, whether as a physician or a lobbyist, and how your background kind of shaped that path for you. Dr. Kahn, would you like to go first?
Okay. Well, when I started practice, I joined the Michigan State Medical Society and became involved a bit with their governmental arm. That's how I met Dan Farhat, actually, and became interested in how we as physicians could impact the laws that went forth in Michigan and the departments. In those days, the Department of Community Health. And that led to an interest in perhaps serving and viewing service in the legislature as another way to practice medicine. And during my career in the legislature, that was exactly the case. I served on medical-related committees, mostly in appropriations, but not only. And thus I'm here today.
Oh, thanks, Dr. George. Do you want to go next?
Sure, I'm happy to. And yeah, thanks for putting this program together. I think our physician colleagues, in the audience will find it interesting. I, was probably like many of them. I was really busy in my practice and had no interest in political affairs. And I actually blame all this on my wife. I went to U of M, and this will explain, I think, pretty much how this came about. At U of M, there aren't many college Republicans, but I married one of them. And so when we settled in Kalamazoo, she's like, I'm going to join the local party and get involved. And I'm like, okay, go ahead. And so I would tag along at events. And there's actually a little bit of a lesson here to those of you, that are interested, but maybe not engaged. If you've decided if you're a Republican or a Democrat, if you know you're one or the other, you should just join your county party. I mean, that's how you're going to have access. You're going to learn what's going on. So my wife joined the Republican Party. We get invited to all these events, Christmas parties, barbecues, and she would go and I would have to go. And I wasn't all that interested in it at first, but then like Roger, I also was a member of the State Medical Society. My practice, it was a private practice. They had a group membership. I knew nothing about that either. I'm just, I'm in this group and we're members. And they would meet with the legislators quarterly in person for a breakfast. So I'd go to that and I'd see some of the same people. Of course, it was bipartisan. And I thought, this is really interesting. And so over, span of a few years, I became more interested in the way the state legislature operates. And by the way, the state heavily regulates our medical practices. And it turned out that the Medical Society had a program, and we could do this today for you if you're interested, where they would bring physicians to Lansing for a day. And my wife and I went with Dan Farhat. We were both a lot younger then, but he was with the Medical Society as their government affairs chief. And we spent the day, we had lunch with our legislators, and I'm like, this is really interesting, the interplay of medicine and politics. So that's how I got interested. And then as time passed, I paid attention to the local races. And because of term limits, there was an opening. So I eventually ran for an open state House seat and won, and then later ran for an open state Senate seat. But again, I blame it all on my wife and the Medical Society. It was those two things coming together that really opened the door on legislative affairs and policy issues. Otherwise, I would have had no clue.
Mr. Farhat.
Thank you, Rebecca. Unlike these guys that actually got, degrees in medicine, I attended Michigan State. I graduated with a dual degree, political science, pre-law, and business administration and management. I had no idea I was actually accepted to go to law school. I graduated in May. I got accepted to start law school in September. And my father, who at the time was also a multi-client lobbyist at this time, he actually helped found the firm Public Affairs Associates in Lansing. He wanted me to take an interview before I started law school. So I had already got an internship with the Attorney General's office. So I worked from May till August for the Attorney General. I worked for 12 attorneys in that department. I was in corrections actually for that internship. Learned a lot of valuable lessons in terms of my first road trip was to go get a deposition at Jackson State Prison. And just driving into the building, I had an idea that, if I had my way, I'd have every high school send their sophomore classes and they'd have to do a road trip to see Jackson State Prison. I guarantee you it would have an impression on young kids to see that setup. But he arranged for me to have a meeting, and my two previous speakers knew him very well. Kevin Kelly, who was the executive director of the State Medical Society, very soft-spoken, very quiet, and I met with him and he convinced me to take a job with MSMS that fall. So I put off law school to do that. And unfortunately, I got the bug not very long into it. And so I kind of grew up, though, in a family of, I don't want to say politics, because but my father was a multi-client lobbyist. My sister was a state rep, a Democratic state rep from Muskegon. My brother ran for her same seat years later as a Republican, and he served 4 years as a state rep. Growing up, my father would have members from Muskegon, the state rep, state senator Arthur Holtz. They actually would come over to the house and get advice on certain things. And I liked to play golf when I was young, and he would drag me into playing golf with certain senators and representatives as kind of filling out their foursome. And so I learned a lot at a young age. But then I got started with MSMS. I spent 8 years there. And unfortunately, Tom's already told you how old we are, because he was my first doctor of the day. And it was a great program. It brought in physicians that were new members or relatively new members. And I would arrange for meetings the entire day. So they would meet their state rep, they would meet their state senator. And it was a way to kind of open their eyes to, you can practice medicine, but I can tell you, after 40 years of doing this, there's a capital about 4 miles from my home, and they like to practice medicine too, but they don't have degrees. And so I'll start the conversation there and go from there.
Thank you. So I guess for anybody, like, how can professionals from clinical and advocacy backgrounds effectively collaborate to try to influence policy without necessarily getting pulled into partisan dynamics?
Well, we all have currently or in the past relationship through the state medical society, but it isn't just the state medical society. There's a county medical society as well, and the county has access to issues that affect us all physicians. The state does too, and as Tom mentioned, you don't have to be a Republican or a Democrat to go to a meeting where your local legislators are going to speak, and you can form a relationship that way. Having an interest in the issues that are before us as healthcare people is really important, and I would urge all of the people that are on this webinar to consider becoming involved, at least to understand the issues that are before them and how they affect their ability to be involved in healthcare.
Yeah, I'll pick up on that if that's okay. I agree with Roger. We're more effective in numbers, and we have a natural outlet, and it is our medical associations or medical societies. And what we find today is most physicians belong to their specialty society, but the membership in the state medical society, MSMS, has fallen off drastically over about 3 decades. And this has paralleled the move to more employed physicians. And, for various reasons, employed physicians are just less likely to join the state medical society. Maybe they have a limited, budget for association dues, whatever it is. They join their specialty society. Well, that's good. The specialty societies are fine. They're mostly focused on their scientific meeting. They're less able, they're less effective, and they're less focused on advocacy work. You really need the state medical society to do that. So part of my message is, if you want to be effective, you need to join the state medical society. Number one, go to the website. It's msms.org and become a member. And as Roger mentioned, there are also county medical societies, and it turns out the membership is joint. So when you sign up for MSMS, it's going to look at your address and it's going to assign you to the appropriate county medical society. And it's the county medical society that hold these they're usually quarterly meetings with the legislators. So when you join, you're going to get invited. You can be one of these physicians. You're busy in practice. I'm not expecting you to run for office like Roger and I did, but you can join the society and you can show up for the quarterly meetings with legislators. And they're great. They're usually well run. They're super interesting. One of us from MSMS usually attends, to help manage the meeting or to provide an agenda. And some of them are held by Zoom, some are in person. It depends on the county. But I would highly encourage you to attend and take advantage of those. And here's a sad example of what's happened. I was on one representing MSMS last week. It was the Washtenaw County Medical Society, had their meeting with their legislators. And it was great. There were 6 legislators. Debbie Dingell was there, their congresswoman, on Zoom from her office in Washington, D.C. It was 7 in the morning. She was all disheveled. It looked like she'd just gotten up or she'd been up all night working, and she was awesome. I mean, she filled us in on all the stuff she's doing related to healthcare. Then we turned to the state legislators. There was a bipartisan group. We covered several topics. So there were 6 legislators in attendance. There were 5 physicians. 3 of them were retired. Like, where are the doctors? You're complaining about the way things work. You need to come to these meetings. So if you're in a busy practice, you're in a busy department, you can't get away for an 8 a.m. meeting, 7 a.m. meeting, you need to have your department chair book that time. You send somebody to the Pharmacy and Therapeutics Committee meeting, you send somebody to the OR scheduling meeting, somebody from your department or from your practice should make this a priority to go to these quarterly meetings. They're just as important as the hospital committee meetings that you're attending.
My turn to jump in, huh? I agree with 100% with what they're saying, but I think individually as a physician, and I know you're busy. The healthcare today it's absolutely crazy out there in terms of patient volume, all the things you have to do to adhere to the insurance companies, reimbursements, all of those things. I'll give you an example though of how important it is for doctors to get engaged, and whether that's one doctor picks up the phone and calls their state rep and has coffee with them, which a number of our doctors do that are from MSMS. One issue, focus on the issues that you're interested in, but issues that are being discussed. For example, when COVID first hit, the governor's office, the Senate Majority Office, and the Speaker's office all reached out to me to set up people from MSMS, doctors. So we had a panel of probably anywhere between 8 and 15 doctors that were willing to sit in on a weekly phone call with the governor's office and with the Senate to talk about what are the things they need to do. And it was very interesting because even our physicians, and I'm talking about docs that were in the trenches, in the ER rooms when patients were presenting, the kind of guidance changed week by week by week. First the state was purchasing all this medical equipment, gloves, gowns, masks, but we went from COVID was a touch virus versus a airborne virus. I even signed a client during the period, UV Angel, which does eliminates pathogen control in ERs that they install in hospitals. They got a $10 million grant to provide their technology currently at Henry Ford and Trinity right now. But my point being is you had a Democratic governor, a Republican senator, and they were literally asking the medical society or doctors to kind of advise them on what they should be doing week by week by week. So you're not getting pulled into the politics, you're getting pulled in for the issue, and they trust your judgment on how to treat things. And we've had a number of those types of issues over my career representing the docs, but it's an example that if you have something to offer, please get involved. And we've had doctors, both of the ones on this panel have served in the legislature. We've had a couple other doctors serve previous to them. We have a current doctor serving from Kalamazoo right now in the House. And they will love to get connected, both in their district and in terms of specialties that can help them kind of forge decisions based on facts and not just the politics of what people are doing, which today is a little harder to separate. It's just the climate that we have, but you can definitely make an impact if you engage.
Thanks. I'd be interested to hear if there's other examples of where like a policy initiative or a legislative effort where physician insight and advocacy support work together to try to create some meaningful change.
Well,
Let me,
sure.
go ahead, Margie.
The hospitals, hospital committees have interactions with legislative and state committees. They can be helpful in starting off there. The primary, for me, I'm a cardiologist. The American College of Cardiology has a state level and national level committees that can point you out what the important issues are. Rebecca, you're a psychiatrist. I used to have your state organization when I was in the legislature would get a hold of me from time to time. And well, as we're speaking, I have a letter I'm supposed to get a hold of the Michigan Primary Care Association. There's some concerns about tax credits in this new bill, that the big beautiful bill, and there's some interest in having them interact with local legislators, physician to legislator. So there are other ways you can access information and find ways to be active than MSMS. It just happened to work really well for me at my time.
There are, I think, 4 kind of general areas where physicians or physician advocacy groups like MSMS come with a lot of credibility. It's basically four general categories where we have a vested interest and we need to be at the table. Sometimes we're invited because of our expertise. Sometimes, we have to invite ourselves. But these areas are the liability system. What happens when doctors get sued? How does that work? Each state regulates that differently. And Michigan, there was an initiative by the Medical Society about 30 years ago. There was a malpractice crisis here. Most of you, listening wouldn't have lived through it, but Roger and I did. We were down to only 2 liability carriers in Michigan. And so MSMS worked hard for almost a decade to get the laws changed. And there were two major reforms. One is a cap on non-economic damages. So a jury can't just say, oh, here's a $100 million award. It has to be based on economic loss. And the second piece is, if you're getting sued, the plaintiff's attorney has to be board certified in your specialty if you're board certified. Seems like a no-brainer, but that wasn't the law before. So if you're a psychiatrist, you're sued, the plaintiff's expert has to be a psychiatrist. So we fought for those things, 30 years ago. There was an attempt to repeal them, by the way, recently, which we fought off, so they're still in place. But that's an area where we have a vested interest in. And it's a public, interest too, because if there's a $300 million award against some rural hospital, how that's going to hurt that community. So we need to be at that table. That's one area. A second area is scope of practice issues. There's always legislation to broaden the scope of practice of the allied health practitioners that we work with. There's always one or two out there. So I won't spend a lot of time on it, but we have an interest in keeping an eye on that. We work with those allied health practitioners, we all do in our practices, but that interaction is regulated by state law, and there should be some degree of physician oversight. I think, most of us would agree. A third area is the payment systems, Medicaid, insurance, Blue Cross, those are all regulated by the state. We have an interest in that. And a fourth one, where we are often invited and we don't have to, butt in, has to do with public health issues. So things like smoking laws, you may not remember, but there was this initiative when Roger and I were there to provide smoke-free air in workplaces. It was very controversial at the time. Now we take it for granted, but there was a smoking section in bars and restaurants, and that didn't work too well. So MSMS and other specialty groups had a keen interest, in these public health issues, and we're often asked to comment on them. More recently, things like lead poisoning has been in the news, so MSMS has been involved in that. Firearm safety, child safety seats in cars. So those are the four categories where we have an interest, and we come with some, degree of credibility. And it's important, that we're at the table. Otherwise, those decisions are made without us.
And Rebecca, as Tom just mentioned, I'll give you kind of a politics 101 quick class, because I don't know if everyone on the call even understands how this process works down here. But for example, and I'll give you a live example. A bill gets introduced, whether it's a House member or a Senate member, the bill gets introduced, it gets attached a number. I'm going to use the live one, House Bill 4399. It was introduced by Representative Dave Preston. He's a UP lawmaker, Republican, sits on the House Health Policy Committee. He introduced a bill that would allow nurse practitioners to have independent practice. Currently, they operate under direct supervision or supervision of a physician. This bill would gut that out to allow them to basically see patients, diagnose patients without any conversation or communication with an overseeing physician. MSMS for really my whole career has always promoted the health team model, meaning you have a team of providers and the doctor or the physician is the leader of that team, responsible for that team, because most of the liability falls under that physician who is supervising. Currently, that bill is sitting in House Health Policy. There's 17 members on that committee. We've been working this bill diligently since it was introduced about 7 months ago. The sponsor of the bill has pushed the chairman. The chairman is Kurt Vanderwell. He's a Republican from Ludington. He's a former Senate. He served 2 terms in the Senate, and he still had, under the new term limit laws, had 4 years to serve in the House. And so he took over the Health Policy Committee. They're going to need 9 votes to move the bill. We are using physicians from across the state to communicate to those 17 members that are in committee to obviously try to influence them to defeat the bill, or at least amend the bill to where we maintain some type of collaborative relationship with the doctor. But if the bill does come out of committee, which it could, it then goes to the House floor. The House floor is 110 members. 58 of them are Republican, 52 are Democrat. They need 56 votes to pass that bill. So as this bill progresses through MSMS and other specialty groups, we will continue to unleash as many doctors as we can in all of the districts out there to try to influence their decision-making on this bill. Then it goes over to the Senate. You got to look at it as almost like a football game. there's 4 quarters. The first quarter is the House committee, second quarter would be the floor. Then if it passes, it goes over to the Senate. They'll refer it to a committee. This go around, they'll probably refer it to either health policy or to Senate Regulatory Affairs. If it goes to Regulatory Affairs, it's because the sponsor wants to kind of go around the Health Policy Committee, which they didn't do very well in last session where this bill was alive. But again, if it goes there, you have 12 people on that committee. You need 7 votes to move it. And then it goes to the floor. There's 38 members on the floor. Right now it's 20 Democrats, 19 Republicans. However, that changed when one of the Senate Democrats, Rivet, won a congressional seat. So right now it's 19-18. And the governor just called for the special election to fill that seat. So the stakes are high. And, again, I'm going to push that. I know physicians are busy practicing, but this is a big part of practicing, because if you let these bills go through, you're letting what I would say less, I don't want to say educated, that's the wrong word, less clinically trained people directly treat patients and diagnose their problems.
So
I think if I could, I would just follow up on that a little bit, if I could. It is an interesting dynamic here with this bill that would allow nurse practitioners to practice totally independently. And as Dan said, it allows them to diagnose and treat. That includes prescribing narcotics, prescribing tests, MRIs, CAT scans, EKGs, and reading them, prescribing and interpreting tests. So, this is a, wide open. There's nothing that they wouldn't be allowed to do, that physicians can do. So an interesting dynamic, though, is probably, I'm assuming, probably many of the attendees here, work in large hospital systems. And you should know that the hospital systems, they like this. So the Michigan Hospital Association, they're in support of it. So this is an issue that illustrates how sometimes the medical society and the hospital association do not see eye to eye. We are not the same thing, okay? So if you're an employed physician and you're working at a large system, believe me, they are members of the MHA, okay? They're paying their dues. Your hospital system is paying their dues in the MHA, and they got an army of lobbyists. And they're saying to the legislators, oh yeah, we need this. We need this to pass. And, what's going to happen if it passes? I mean, look at your departments and, when they're not going to need, physician oversight. So this is an economic issue for the hospitals. And so when you're not a member of MSMS, the hospital's speaking for you. They're talking for you if you're not a member. So that's why it's important to be a member of your specialty society and the state medical society. The hospital is saying they're speaking for you if you are not a member, and that is not accurate. Don't let them be your voice in Lansing.
On that, just a little additional depth. Smaller hospitals argue that they don't have access to the staff, for like anesthesiologists, for example, or primary care physicians, and that unsupervised PAs or unsupervised or able to practice independently PAs or nurse practitioners allow them to continue to have a viable hospital. There's really 3 arms to all this. There's a quality, there's cost, and there's access. And the quality issue seems to be a poor third in most discussions these days. So you get the back and forth on this stuff, and ultimately the rules get made by the people that show up, and we need to show up, and either through your specialty society or influence the way your hospital looks at things, or we used to have a day in Lansing, when people, medical students from Wayne would show up en masse. And hopefully that'll continue and they get educated and understand how to make quality the issue it ought to be.
So if one of our attendees does have like an issue that they're passionate about, what would be the most effective way to ensure that their voice is heard and understood by lawmakers and government agencies?
I would say so if they're not a member of the trade associations or the county, you could communicate your issue through them. I've seen a lot of issues over my career. The medical society has a House of Delegates. Members from each county can submit issues that they want to be formally recognized by the association. But if it's just something individually, I mean, I've got a number of doctors over the years. I'll give you a most recent is, there's a doctor, Mark Komorowski. He's a plastic surgeon from, is it Bay? Roger Bay? Yeah. He took the initiative to really just, and I'm not singling him out. Other doctors have done this too, but he took the time and the effort to contact each member from his district, and actually it's a tri-county district, so there's more than just one legislator. But he took the time to set up, coffee, breakfast, whatever, with the state senator from his district, the state rep from his district, who are Tim Beeson and Representative Daley, or Senator Daley, I'm sorry, where he's now has a relationship built to where they actually pick up the phone and call him on issues that come before them. They don't always agree, especially Senator Daley. We've had issues that have gone through committees that he might not have voted the way we would like, but he is accessible to him any day of the week. And that's the kind of engagement that you have to start with. And trust me, once you do that, and it is difficult to sit down with somebody you don't know, who's not part of the medical world, and you may not even like them, but they are all pretty accessible to listening. And I think the more you can engage yourself, especially on issues that are of self-interest, you'd be shocked at how many times somebody will meet with a state rep and a month later there's a bill introduced on exactly the issue that doctor wanted. Because they are there to kind of serve their district, and it's a way for them to, open their kind of contacts. And we have a program that we instituted years ago at the Medical Society where we actually keep we kind of put together a list, and we make sure that we have 4 or 5 doctors from every district as part of a contact to that specific legislator. And so, there's all kinds of options that an individual doctor could join into. They just need to really engage. And I'll use that word a lot because I've noticed over the last 10, 12 years that before Tom took over at MSMS, we kind of lost that edge. And what I mean by that is we weren't having doctors coming to Lansing. And it does you no good to have a lobbyist try to testify in a public committee because we're lobbyists. We're frowned upon in the environment. You've got to have experts. And we have now rebuilt that over the last couple of years, and it's paid dividends immediately. Like Tom said, we've fended off some tort reform changes. We've been fending off the scope of practice change, and we're engaged in trying to promote, certain issues to better the medical issues that are out there. You're on mute, Tom.
I can give a specific example, which might illustrate kind of how the process might work. If you're a physician in practice and you see something that you think, state law should be changed, what should you do? So I'll give a specific example. I had a constituent, this was not a physician, but a constituent whose um, uh, infant granddaughter died and was found to have at autopsy, a rare inborn error of metabolism. And the constituent found that this is something that could be tested for and wanted it added to the neonatal testing panel. So they went on a campaign to add this one condition. They emailed me, sent me the material. I'm like, yeah, this sort of makes sense. I'm not an expert on it, but I sort of became a little one. Contacted, the people in the field, and other states are starting to test for this. And so I had a bill to add this to the neonatal testing panel, and my constituent wisely also contacted a special interest group, and that was the March of Dimes. March of Dimes still exists, and it advocates for, treating infant diseases, and they are an advocate for expanding the testing panel. And she went to the March of Dimes and got them to pass it, their board. So they endorsed her idea. So it wasn't just her anymore. She broadened her reach by bringing in an association, in this case, the March of Dimes. And eventually, and so it wasn't just me saying, I've got this bill to pass, I need people around the state talking to my colleagues so they see that it makes sense. So the March of Dimes is able to do that because they have members all around the state. And so this is an example of how an association works. And the bill eventually passed. And by the way, every year now in Michigan, they find 2 or 3 babies with this condition, and it's totally treatable. Totally treatable. So, what a great story. I mean, a sad story, but with a good ending. She has saved lives, this grandma, by doing this. She saved lives. And, it's awesome. It's an example of, how law can be changed for the good. So, if you have something, an idea, you can bring it to a legislator, but having the voice of an association to help you, makes your voice stronger. And your association is the medical society. So if it's something that we don't know about, we've never heard of it before at MSMS, you can, if you're a member, you can send a letter to our board of directors. You can bring it to our annual meeting and we'll discuss it and vote on it and make it a policy. We have a rich policy compendium where members have brought these ideas, and it's actually on our website. So you could look and see, is this already on the web? Is this already policy or not? And it could be added to our policy by bringing it, to our attention. And then it's not just you, but then, you have the voice of organized medicine with you.
These sort of things where a constituent brings something to you are pretty common. A similar example that I had is a young lady was, I don't know, she was 16 or 17, a new driver, got killed in an auto accident by somebody who was on a cell phone. And her family and friends, and actually it was the chair of the opposite political party to the one that I belonged to, brought it to me and her to me. And we ended up working on a bill to limit cell phone usage in cars. And those sort of things give you a feeling of connectedness to improving our society and improving our lives. And you can do that. Each physician has office hours in his district, whether it's a senator or a representative, and there are frequently things that come from the various departments, Department of Health and Human Services, for example, that have meetings within the district, and it might not be exactly on the subject you want, but if you can go to them, they'll give you the person in that department that you can talk to. It's worth doing.
Those are great examples. So I know Dan mentioned earlier kind of the current political climate and kind of the polarization. So how do you maintain a focus on patient-centered outcomes and public health while navigating the political and kind of bureaucratic challenges of policymaking?
I don't think that's terribly difficult. You might be intimidated about that and feel that you're going to be co-opted into a position that you don't really support by contacting your legislator, but that generally is not true. When you're talking to them, they don't ask you whether you're a Republican or a Democrat or a contributor to them. They want to understand your issue. They want to know how to get in touch with you, and they'll tell you what they might be able to do or cannot do, or what committee you could refer yourself to. And well, Tom and Dan, did you find any co-opting of individuals who have issues into a political position they don't like? There's a saying in Lansing that, look, the guy you disagree with today is going to be your ally on another issue tomorrow. So why get into a brouhaha that is a no-win situation for anybody?
Yep, that's a good point, Roger. And also, again, it comes back to engagement. If there is an issue and you don't engage because either you're concerned about the politics or whatever, just know that same lawmaker is getting engaged by 20 to 30 other people that may not share the same position that we in the medical community would share. And that does influence. My brother, when he served, he literally kept track, and I'm sure my sister did also. Um, they get a lot of pressure from their leadership. So, for example, the speaker, the budget's going on right now, or the budget isn't done yet. And the Republicans are doing their kind of model, and the Senate Democrats are doing theirs, and the governor's kind of caught in between trying to figure it all out. But my brother would keep track if he was being contacted in his district. Then he literally would, if he was being advised by the speaker or leadership to vote a certain way on a certain bill, if it was something that he got information from a constituent, he might not agree then with the speaker, because they all have to go back home to their districts to get, one, reelected, and two, they do need to expand their base of support. You're going to see it pretty much in the next, May, when the next filing for the 2026. It is a huge election because you have an open seat for the governor. Whitmer is done. So that'll be a battle for either Republican or Democrat to win the governorship. You've got a House that took control from the Democrats. Now they have to try to maintain that control. And then you have a state Senate that is very close, 20 to 18. And, a lot of money is going to be spent trying to flip the Senate seats back to a Senate Republican majority. So the politics are going to get huge here in the next, 4 to 5 months.
So I want to leave a little bit of time for questions from the audience. So again, if our audience members have questions, you can submit those using the Q&A button. But I do have one last question for you, gentlemen. What advice would you give to medical professionals? And I'm going to expand that because I'm also a training director. So medical professionals, residents, fellows, medical students who are interested in public policy or advocacy roles, whether they want to serve directly in government or collaborate through lobbying efforts.
Do I get to go first this time? Okay.
Sure.
I'm gonna once again, my first advice would be, if you have the ability, join MSMS, join your county medical society, be active with those physicians that are members of those organizations, be active with your specialty society people. Again, engage. But I really, I mean, if I had to advise the upcoming new doctors out there, my experience has been that when guys like Roger and Tom and others, Joe Schwartz, when we had a doctor serving in the legislature, um, health policy or just policy in general was much better than not having a physician actively sitting in either the House or the Senate. And if you can't find, and again, MSMS, we actively try to recruit physicians to run for certain seats, and we try to pick seats where they can, if they do run, they can get through a primary and actually have a shot at serving. If you don't have the time and you just don't have the stomach to do that, then I strongly again advise to just engage in your own community. You'll have a state rep there, you'll have a state senate, get out and make sure that they know who you are. And I guarantee if you make that effort, you will be able to indirectly impact some of the decisions that are being made in Lansing.
We've been talking mostly about state issues because that's where we come from. We could have talked about federal issues. That probably is the one that individual people in our country see the most often, and actually confuse state lawmakers with federal lawmakers. But there are also school boards, and the school boards are for the longest time have been the training ground for people who have interest in those sorts of issues. And if not a school related issue, you could look at county commissioners. What's going on in your county? And they could give you some guidance on who you might talk to at a local level or state level or even a federal level. If you have, what are your issues? You need to think of for a moment of what do I want to support? What do I want to defeat? What would I like to see changed? Who can help me do that? Here at Wayne, the Alumni Association, we have lots of folks on the Board of Governors that are contactable and are spread across the entire state, and they can give you some guidance on where you could go or who you could talk to or what you could talk to them about. So it's out there if you will grab a hold of the ring and reach out.
Yeah, I have a little bit to add to that. So if you were interested in running for office, Roger and I and Dan would love to talk to you because we want to recruit candidates. And one thing we would tell you to do, or one option you would have, would be to go to campaign school. You went through a residency. That was 3 to 5 years. Campaign school is usually a weekend. It might be a week, but you learn all about campaigns in a brief, span. It's actually a lot of fun. I did it. The AMA runs one, and it was in Washington, D.C. It was bipartisan. It was fascinating. I did it before I ran. So if you're interested in running for office, yeah, talk to one of us. But most of you probably aren't interested in running for office. So what can you do? Well, we've already said, join MSMS, participate in your county medical society legislative meetings, book that time out, make it important. And if you can't, somebody from your department or your practice should. And then there's a couple other additional things. Let's say you go to one of those county meetings and you meet your legislators and you like one of them, like this guy or woman, they're listening to me. They get it. Then support them. If with the campaigns, right around the corner, believe me, if you send them a check for $100, they're going to be your friend for life. I mean, they have to raise money constantly, and it's so hard. Nobody wants to write them a check, because everybody hates politics. If you find one you like, then support them, help them, and go to one of their events, one of their coffees. And they're like Roger said, you're going to get their cell phone, they're going to get yours, they're going to call you next time there's an issue. So go to your legislative county meetings, try and find a legislator you actually might like, And then another thing to put on your radar is every spring, MSMS has an advocacy day where we meet en masse in Lansing and we go make capital visits. We haven't scheduled the actual date yet for next year. It'll be in the spring, but it's open to medical students, residents, faculty, practicing physicians. It's during the day, so you got to plan ahead. But we love having medical students and residents there. And residents and medical students can be members of MSMS. I think for residents, it's $20 a year. So if you're in a program, you could get your residents a group membership, and you could, if they were post-call, you could send them to Advocacy Day next year. So there are some ways you can, you can get your students and residents involved. And one of the best is Advocacy Day, an actual day in Lansing, to meet your legislators in their offices.
Great, thank you. So we have a couple questions that had come in earlier, and then we'll see if any come in the chat. One of those is, what do you see as the greatest weakness or blind spot that physicians stepping into public service or advocacy roles face? And what advice would you give for navigating that successfully?
I think one of our greatest weaknesses is lack of involvement. We need to find the time to lend our expertise in the healthcare arena and help to guide it and answer questions and to point out pitfalls.
Yeah, I would agree with that. I think our weakness is just not being active enough. And believe me, if you call your state rep's office and you leave a message, and the clerk who answers the phone says to the rep, we got a message from Dr. So-and-so. They're a surgeon at such and such a hospital. They're going to be like, holy, wow, they don't get calls from physicians that much. So don't be afraid to use that power. Physicians are respected. You have a right to petition your legislators, and you will be surprised at the response that you will get. You will usually be, your input will usually be welcomed. So we don't take advantage of it enough.
And then I'll just add that there's two real key ingredients to working with the legislature. And they both mentioned, they do need support. There are fundraisers all the time. Trust me, all the time. But you have two options. The Medical Society has MDPAC, which is a political action committee, where you just write a check to MDPAC. They compile all these checks together, and then they have a board that actually goes through to determine which candidates they're going to support or not support. The other piece that I've always been very proud, MSMS has been one of my first clients when I first started my firm. So I'm a little more allegiant to them as a client versus the 20 or 30 other ones that we, and the reason I say that is I think the blind spot is physicians don't realize how big their grassroots really is. There is doctors in every community where these people come from. And I think the weakness has been that as a group, they just don't engage enough. They're not participating enough. And I think if anything, if we could increase physician involvement, like Roger and Tom just mentioned, it'll go a long ways to replacing what you need to raise in terms of financial. And when I say that, and people don't like to hear, the money part of politics, but it's real and it's there. And I can tell you 20 years ago, if you looked up the top 5 Michigan political action committees, MDPAC was right underneath Blue Cross Blue Shield. If you look that up today, Blue Cross Blue Shield hasn't moved, and others have then transcended us. And that's something that over time we have to address, because it is important. You're not going to have friends if you can't elect them, and you got to get them elected. So it's a message that I have to deliver, and people don't like to hear that money is a part of this game, but it is a big part of this game, because I watched, both my siblings ran, and they were both in the #1 target seat for control. And I think my brother's race, I think he had to spend $1.2 million. And we're talking about spending $1.2 million and losing, but $1.2 million to get a $75,000 a year job. I mean, that's how crazy the political landscape has become, with all the national money and outside money that comes in to try to, impact elections. So
Thank you so much. Thank you all for your insightful presentations. Unfortunately, we've come to the end of our time. I want to thank all of our attendees for coming to tonight's webinar. Please check back to our website and follow the newsletters to hear about any upcoming webinars and events. Dr. Kahn, Dr. George, Mr. Farhat, thank you so much again for sharing your personal journeys with us and with all of our attendees. I'm going to steal your quote, Dr. Kahn. I really like that. I might use it with my trainees. Rules get made by people who show up, and we need to show up. So I'm going to take that away from today. Thank you so much for all of your time, and have a wonderful evening, everyone.
thank you.
Thank you.
Bye now.